Welcome, everybody. I'm Danelle, co founder, co presenter, and 20 plus years mental health wellness counselor. And today I'm just delighted that we're going to go into conversation with Annie. She's a 34-year-old social services educated harm reduction advocate. She has worked on Vancouver's downtown east side supporting street based sex workers and is now returning to complete her social work degree. Annie is also a certified full spectrum doula. Annie lives with disabilities such as fibromyalgia, treatment resistant depression, and PTSD with that. And I remember talking to you prior to this conversation. I think you said it started with mononucleosis. That's when you first noticed.
Yeah, when I was 14, I got diagnosed with mono, and then I was never the same after that. Like, I never fully recovered.
Okay. And so that's really when you saw things happen after you were diagnosed with that. So what came next after mono? When were you diagnosed with the other disorders?
So I lived with all the symptoms up until I was 31, and then I officially got diagnosed with fibromyalgia and chronic fatigue syndrome. But earlier on, like when I was a teenager, I got diagnosed with depression and PTSD. And the reason why it's treatment resistant is because I've tried many different medications and therapies, and it's still a part of my life.
Okay, so fibromyalgia, what is that? How would you
It's
describe that?
it's a central nervous system disorder. It's where your neurons fire off pain signals too frequently, and with like simple touches, it can be very painful. It affects my muscles, my joints. It causes nausea, chronic fatigue syndrome, daily headaches, and so on. Like there's more. But yeah, it's just basically my brain sending wrong signals throughout my body.
So then chronic fatigue, is that typical that goes along with the fibromyalgia? The
Yeah, almost everybody with fibromyalgia has chronic fatigue syndrome.
okay.
And that's basically inflammation in your brain. But because you're in pain every single day, like that's really tiring. Um, and it just sucks all the energy you have, so it makes daily tasks really difficult. And I'm on disability because I can't work because of my pain and my chronic fatigue.
Right. And was it hard? Like, tell me about the journey of being diagnosed. So, first of all, it was mononucleosis, and then more and more started showing up, or was it like mononucleosis and boom, there you were with the depression and the fibromyalgia, fatigue, all of that? Was it sudden onslaught or was it gradual?
It was sudden for me. Like I said, I never fully recovered from mono. And over time, it just kept getting worse. Like the symptoms kept progressing, and I was bedbound for many years, like unable to work, unable to get simple tasks done. And I was just sleeping my life away.
How does how do you go about getting diagnosed? I do know from speaking to other people and even yourself prior to this interview that quite often um, you don't know what's going on, and people around you, like family, friends, just don't get. the intensity of what you're going through. So, how did you go about getting diagnosed and finding the right steps to what you needed? How did you do that?
Well, it was multiple doctor's appointments with specialists and my GP, and we had to rule out a bunch of other diagnoses first in order for me to finally meet with an internal medicine physician. And once all those other diagnoses, like arthritis or some other autoimmune disease, was ruled out, then just from him asking me questions about what I like my symptoms, he diagnosed me with fibromyalgia in 2021.
What is the treatment for fibromyalgia?
Normally, it's managed with a SNRI that targets nerves as well. You can also go on lots of different medications that people with autoimmune diseases have. So there's medication management, although it's not a cure-all. There's you have to do a bunch of things like together to help you. So yeah, there's medication management, there is various types of therapy. And then really you just have to find out what works best for you. So pacing is a huge one for me. I don't do things back to back to back to back. I have to do one thing, complete that tasks, and go lay down. Then I recharge my energy and I'll do another thing. But if I don't get all of my tasks done in one day, I really have to give myself like a lot of compassion and grace for that because we can be our own worst enemy.
For
We can
sure.
we can be like, why am I not normal? Why can't I do things that other people are doing on a daily basis? Why can't I work? How come my sleep doesn't give me enough energy to finish my day with like a normal person? So you have to practice a lot of compassion for yourself.
For sure. That must uh that must take a lot of strength. And I'm going to use the word strength. And sometimes people don't think of themselves in terms of being strong. But would you say that it takes strength, or what is it that you're drawing the ability to keep going and not only keep going, but keep involved in the life that matters most to you? Is that strength?
I would say it's partially strength. It's also a lot of adaptation
Mm,
in life.
yeah,
Um, but strength is definitely a part of it. But you know, the strength can be mental, it can be physical, it can be emotional, and you kind of just like draw out various aspects of strength throughout your day
hmm,
and you go day to day. It's not week to week, it's not month to month or year to year. It's day by day, really.
wow, wow. So the different aspects of your strength for someone like me, I'm really, really sensitive to throwing the strength thing at people. But we do, when we're on the other side and we're looking at somebody like yourself who is dealing with layers of disorder and discomfort and the journey to find what you need to do for you. When you look at someone like yourself, we see strength. And, but, do you ever feel that it's putting too much on you if people say, "Oh, you're strong"? Does it make you feel perhaps that you have to live up? to that?
Yeah, I definitely feel like that. There's a lot of pressure.
Okay.
And it's often unintentional, where it's like I feel like this disease is so invisible that I pass as somebody who is able-bodied, but nobody knows on the inside how I feel.
Yes.
So I do feel like there is pressure to like be normal.
Right.
Um,
But what is like, is your normal redefined? Like, okay, you were 14 when this first started happening. You're 34 now. And through that course, that journey, have you redefined within yourself what strength is? I think you said that you were alluding to that earlier. And do you allow yourself to stand on what your definition is versus what others expect from you?
yes, I have to. I have to, or else it's just gonna wear me out even more. It's gonna cause more anxiety and more depression for me. So I've really had to like accept what I deal with on a daily basis and just be grateful for those energy pockets that I do have or those moments that I do have without pain because it's well managed that day. Um, it's it's huge for me to not feel the pressure of other people and how they look at me as they think I'm an able-bodied person, but like I said, it's not like that.
There's a lot of unseen complexity that nobody sees, except maybe like your partner, your close partner who lives with you day by day and you're intimate, sharing your deepest.
Mhm.
Um, that person would know and understand to some degree, but really, we're the only ones who really feel it to the depth that we can't even describe for others. Would you say that's true?
Yes, and it's so individual for each person that has these diagnoses. What I deal with on a daily basis may not look the same as somebody else with the same diagnoses as me
That's
looks like.
that's true. So it's like a spectrum, isn't it? But you
Yes.
don't have one spectrum, you have multiple spectrums.
Hmm.
How do you keep yourself from identifying, like putting your identity in dealing with this and what this is? How do you find Annie and all that?
Well, I definitely lost myself for a very long time. I was just in survival mode every single day. And then once I got my diagnoses, I was able to do a lot of research. And I do believe that like education is powerful.
Mm-hmm.
So I just started to find micro joys throughout the day. I have a loving partner, I have my family, I have my friends, I have my dogs, who are all emotional supports for me. And they may not understand completely what I'm going through, but they definitely empathize, and I'm very privileged to have that.
Things that compel you to wake up in the morning and keep going?
Yeah, they make me feel like I know who I am.
Ah, okay. That makes
So, yeah, so going back to school and being educated in something that I'm very passionate about, like social services, it just reinstates who I am as a person. I am an advocate. I care about communities that aren't privileged and um, that are suffering. I just want the best in people. I want everybody to experience happiness in their life.
wow. That work that you did downtown, East Side, Vancouver, that's where, as I said earlier, I'm aware of it. I have had the opportunity to observe quite a bit and interact a little bit, certainly not as much as yourself. When we can step on to that scene and feel compassion welling up within us, does it give you a whole other perspective on your own pain?
Um, mm, it kind of does, but it's more so an outlook that this is a community that majority of them are unhoused. This is a community that a lot of them suffer with mental health and pain. Um, this is a community that uses substances. Not everybody, not to generalize, but they're just human at the end of the day without proper support systems.
Wow. Yes. So you're talking about dignity and respect for life, human life, regardless of where they find themselves, they deserve respect and dignity. Wouldn't you say?
Absolutely. Like I said, they're human beings and they're just navigating through a broken system.
Yes. Yeah. And where'd that compassion come from? Where'd that start for you?
It started when I was really young. My mom was never afraid to take me to the downtown east side and, explore various parts of Vancouver, in the greater Vancouver area. And, like as a young girl, seeing people suffer really hit a chord for me.
Yeah.
And I think that kind of sparked the caregiver in me. And various jobs that I've had in the past have always been more so of a caretaker role with helping empower people to advocate for themselves. And that's huge in social work is you're not speaking on behalf of the person, you're more so empowering them to have knowledge and make the best decisions for them and their well-being, and then therefore they can advocate for themselves.
How far along in your diagnosis were you when you first started going to the east side and doing that kind of work?
I was 30, so 4 years ago when I officially started working as a support worker on the downtown east side.
And so you were smack dab in the middle of, were you diagnosed by that time when you were 30 with everything that you now know is in place for you? Were you diagnosed by 30?
Not officially, but I had a really good idea that that's what was going on for me.
Okay, so then you were doing that kind of work. You're also a certified full spectrum doula, right? So you
Yeah.
were doing that. For how long were you doing that work?
I was a doula for 10 years.
Okay. So you did all that, plus you were navigating the journey of, I know there's something wrong with me. I'm
Mhm.
not feeling right, obviously. Um, so you had to advocate for yourself, right?
Yeah.
Through all that to get a diagnosis. Is that right?
Yeah, I did, absolutely. I had to keep going back to the doctor multiple times throughout the year. And, research and educate myself more and go to the doctor and be like, hey, I heard about this medication or this therapy. Can we try that? It's like a lot of trial and error, unfortunately, but once you find what works for you, and kind of helps take the edge off and makes you feel more human again, like it's it's relieving. It's still scary because you wonder how much sicker you can get.
Right, right. And so that can't help either. That adds to the stress, obviously. So you're just in kind of a cycle in the early stages of discovering what you're dealing with and what you need. You're in the early stages. So there must be a cycle of stress, kind of just turning the wheels of everything that's going on, would you say?
Yeah, absolutely.
So, how did you deal with what did you find and what do you find helps you with stress?
Um, that's a big one because stress is like what makes everything so much worse
Yeah,
for me. So I dedicate myself once a week to go to therapy where I can really talk to somebody that's not going to judge me, that has compassion for me and creates a safe space for me to talk and let things out. Um, I keep an open communication with my partner so that we're always on the same page about things. And I make sure I sleep when I need to sleep. So I really have to listen to my body.
yeah.
And I try to eat really balanced, so that I'm nourished.
So, when your conditions flare up at any one of them, do they sometimes overlap and make it hard for you to know exactly what's going on?
Yeah, definitely. Because the fatigue, it goes along with not only fibromyalgia, but it goes along with depression. And I unfortunately have endometriosis that also contributes to fatigue. So those symptoms definitely overlap. Same with the nausea, generalized weakness, all these things overlap.
What does your inner dialogue, what's it like, Annie, for you when you're finding, okay, here I am with a plethora of these symptoms, or maybe even just two overlapping. What's the inner dialogue like?
It's a lot of suffering. It's a lot of I'm in a place where I'm really unwell and this is not my baseline. And it's basically all I can think about is how unwell I feel. It's really difficult to pull myself out of that.
But do you?
There are moments where I do, like when I just try to do what I know helps me relax.
Yeah.
And then it takes the inner dialogue thought process away from the suffering. And it's not for huge amounts of time, but at least it's something.
Right. It gives you some relief.
It's really difficult to do that for myself.
Well, when a person's in pain, that's all we know and we feel, right? And our whole body is responding to that. Our cognitions, our body, our central nervous system, we're firing at a different rate. So it really has got to be challenging. But in this, and I don't mean but, through this, um, what have you learned about yourself? Have you surprised yourself?
That's a good question. What I've learned for myself is that, again, education is powerful and it doesn't matter. um, how much I'm suffering, I know that I won't feel like this forever,
Right.
where it's past my baseline and things are really, really ramped up in a flare. I tell myself it's not going to last forever, and that really gives me hope. So I was hopeless for many, many years. I was hopeless, and I've been able to pull myself out of that mental block, and that's surprising. Like, I still have hope.
Yeah. That, yeah. So what does that speak on? Does that speak on Annie as a human being who refuses to stand on something that isn't going to support what you want going forward? Does that speak of strength again to bring that up? Doesn't it take a lot of strength? I don't know. I maybe you could tell me this, but doesn't it take a lot of strength to find hope in the middle of your pain? Right?
Yeah, it's almost exhausting.
Yeah, I guess. So you might be arguing with yourself and trying to convince yourself,
Hmm.
right? So you dealt with PTSD and you mentioned therapists.
Hmm.
So does that involve CBT, and does that translate over into those moments where you're going through a pocket of a flare up and you're trying to convince yourself to be hopeful, and you just said it surprised you because you do end up hopeful because you
Hmm.
know you ride the waves, could we say, of this wave, and you always ride it out, and then you come to a baseline. Would that be a good description of that?
Yeah, definitely. There's ups and there's downs, and some downs are lower what than they normally would be. And um, CBT has helped me with my anxiety.
Okay.
But it's more so for me, what works is talk therapy. So my counselor helps me process what I'm going through in that moment.
So having someone to listen to you where you can unload it and
Hmm.
you know you're safe to do so, you're not going to worry about how they feel about how you're feeling,
No.
right?
Yeah.
Because it sounds to me like with the kind of work you've been doing and that you're going forward in, getting your degree in social services, that it requires a lot of compassion. Um, so you're a very compassionate person. And so it's often hard to have compassion on ourselves, isn't it?
Hmm.
So having someone there that allows for you to unload keeps you from being judgmental, maybe? Does that help that way?
Yeah, it does because my counselor helps me validate how I'm feeling.
Yeah.
Um, and so then if I know what I'm feeling is true, then anybody else around me that loved me and supported me would have compassion for me. So I need to practice how to have compassion for myself.
Yeah, and I think in that when we were doing some of your shorts, you mentioned about self-compassion. You had talked about self-judgment and how you stopped doing that. And you even used the word gaslight to get yourself through
Hmm.
everything that you were doing. You somehow came to a place where you went, wait a minute, I I'm I don't have to put that kind of pressure on myself.
Yeah, I spent years and years and years gaslighting myself, and it is a tool. It's a survival tool for me. And I'm only human. It happens still. I'm not like perfect. Um, but if I'm not feeling well, then I need to own that because if I push myself over my limit or my window of tolerance, then I'm gonna crash even harder and it's gonna take longer for me to recover.
Right. And your doctor really helped with that, right? Like he went through, like you applied for disability,
Hmm.
and your doctor sat down with you and went through the application. And what did that do for you when he was asking you all these questions?
Well, having a doctor validate that for you is not something that happens very often in the patient doctor relationships. Like, of course, there's amazing doctors out there. There's amazing healthcare workers, nurses, but to really talk about how the disabilities affect you on a day-to-day basis, like it affects sleep, it affects eating, it affects going to the bathroom, mobility issues, all of those things really like sets it in stone, that you are heard and you have that physician on your side. It's really not something that happens too often. But when it does, it's like healing.
Yeah, and it brings about a realization, wait a minute. I think you had said to me, it brought about a realization I am somebody who isn't well, right? And we made a little short on Inspired Onward. It's posted on there on YouTube, but you were talking about how you came to a place where you went, wait a minute, this is real. Is that
Mhm.
correct?
Yeah, definitely. Because it was set in stone. It was written on paper, signed by my doctor. The government approved it. It felt so real for me.
Did that help? Does that help you going forward to be nicer to yourself, even?
Yeah, absolutely. Because having it all written down on an application form where every section is filled in with something,
Wow.
really, really like made me realize I am disabled. And that's not a bad thing. That's just what my normal is.
Right. Because I know that you've got plans for your future. You and your partner have a little quiet spot on a island just uh, off of Vancouver Island, BC in Canada. And it's a real quiet environment. And that helps you to find yourself and to find peace. Because environment is so much, right? But
Hmm.
getting yourself to the place where you can say, this is my norm. I'm bringing in things that help me to be well in my norm and that build me up in my norm, like your environment that you and your partner live in,
Yeah,
your dogs, your interest in social services, and the pursuit of your degree.
lucky to live on a small island where I'm surrounded by the mountains and the ocean and beautiful forest. Those are really healing for me. Instead to be in a city where you witness every single day the hustle and the bustle, and all these people around you are functioning from what you can see,
Right,
and you tend to compare yourself a lot.
for sure. So, just a couple more questions, Annie. I am so grateful that you're spending this time. Like, I am learning honestly from you. It's those real quiet inward dialogues and narratives, like you just said, where you're seeing everybody going about their day and their business and being busy and doing this and that. And it's hard not to look and go, well, I'm trying, but it's really hard for me to be like that and then not judge yourself. So pulling out of that environment and going to some place quiet where the life and the flow is quieter and a slower pace, perhaps, helps you to reground yourself.
Yeah, it does for sure. And it makes me feel like I am contributing to this society. Like, just because I don't work doesn't mean that I'm any less of a human. I have passions and I get to share those with my community and I get to help others. So those are really like things that are important to me and that helps me feel like I have identity.
How do you have compassion for people when they get you wrong, when they don't understand you?
Um, I remind myself that, it's ignorance and I mean, oftentimes it's not on purpose. So the key is to educate,
For sure.
and then it's up to that person to
Right.
do what they want with it so that it's not my responsibility. I don't always have the energy to educate, but when I do, I really use my knowledge of my own experiences to help others understand
What do people often get wrong about your experience?
that it's not that bad, that I'm lazy, that I should just be able to go back to work, um, because it's so invisible.
Yeah, it's beneath the surface. And you look like we do that, don't we? We look at people and we go, oh, that person is doing this or that, and that person doesn't look necessarily sick, right? And then, but it's a silent suffering, but you have found the outlets to not suffer in silence, right?
Hmm.
So, would you want people to understand what? What do you want them to understand?
I would like people to understand that everybody's pain and suffering is different. And just because somebody looks able bodied doesn't mean that they are. I would say that's a huge one to not just assume.
Right. Uh, for people who find themselves just getting a difficult diagnosis or for caring for someone who is, what do you want them to hear from you today? What would you say to them?
That each experience individually is their own experience as a person, and those experiences need to be validated and supported.
Okay. Well, Annie, thank you again for spending time with us at Inspired Onward today. Really want to say to anyone who's been listening to this, if you find yourself in a place where you're feeling overwhelmed, where you're feeling like you're not being heard, I really, really want to encourage you to find that person who will listen to you. Find a therapist, go to your doctor, find a support group. And don't deny yourself access to the things that bring you pleasure. And I just want to thank you for joining Annie and I today, and we hope that you're inspired.